a heavy box, but I think I can lift it. Okay, here we go. Oh, I need my painkillers. Oh, my back. Oh, the Advent's so far. Here, get the pain medicine for me. Bring it here. Come on. Peanut. Peanut drop. Oh, thank you.
What is up, everyone? It's Everyday Jan. Today, we are going to be talking about why your back is hurting, things you can do at home to fix your back pain immediately, and when you should actually see a medical professional. I am a doctor and I specialize in PM&R, which means people are referred to me when they have issues like back pain. But I'm not your doctor, and this video is meant to be for educational purposes only and not meant to be a substitute for any professional medical advice, diagnosis, or treatment. So, how did you hurt your back? Most often, this happens when you're lifting something heavy, doing any sort of repetitive movement, make a sudden movement, or have poor body mechanics and posture. In your back, you have your bones, which is your spine, and there are muscles, tendons, and ligaments that allow you to move your back in different directions, such as bending, twisting, and rotating. When the physical stress on your back is greater than what the muscles, tendons, and ligaments can handle, then those muscles, tendons, and ligaments can get overstretched and injured, and that can be really painful. It can also be a disc issue, and the disc is like a jelly-like donut that's in between your spine bones. Sometimes a part of that disc, that's called the nucleus pulposus, can migrate or herniate outwards and tear through the annular fibers and cause a lot of inflammation and pain. When any of these injuries happen, you're going to experience sudden extreme pain, stiffness, muscle guarding, and difficulty maintaining a posture due to muscle stiffness and pain. Now, there are certain instances when you're going to want to seek emergency medical attention, as in go to the emergency room or call 911. If you're experiencing any new bowel or bladder changes, as in you can't control your ability to go to the bathroom or you can't pee at all, or if there's any sexual dysfunction or numbness and tingling in your genital areas or inner thighs, then those are symptoms concerning for something that we call cauda equina. The cauda equina is the tail end of the spinal cord, and these nerve roots control your ability to go to the bathroom. If this is compromised, then it has to be decompressed immediately to prevent any further damage. Also, if you've had any major trauma like a car accident or you fell off a ladder, then you need to be checked out to make sure you don't have any fractures. And if there's any fevers and chills along with back pain, then you need to make sure that there's no infection or abscess going on. So if you don't have any of those red flag symptoms, let's talk about getting you out of pain. Now, the one good thing about acute back pain from a lumbar strain is that majority of the cases are self-limiting, which means it gets better on its own with minimal intervention. However, sometimes it can take a couple days, sometimes even a couple weeks. In the beginning stages, those muscles and tissues are swollen and inflamed. So the goal is to reduce that inflammation and control the pain. So the first step is rest and take it easy. And when I say rest, I mean relative rest. Don't lay in bed all day and have strict bed rest, because doing that will actually weaken your muscles and make your pain even worse. But also, don't do anything crazy. You're in pain, listen to your body. For you athletes and gym rats out there, no, you do not have to go to the gym every single day. Doing so when you're in pain is going to prevent you from healing. If you're able to tolerate it, you can still walk around the house and do some basic daily chores, as long as you're not putting too much stress on your back. The next thing you're gonna wanna do to reduce the inflammation is ice. Ice your back for 15 to 20 minutes. This will help reduce the inflammation. You don't want to apply the ice pack directly onto your skin, because you might risk getting an ice burn or frostbite. Now, when should you use ice versus heat? Ice should be used in the initial phases after an injury, so in the first 48 hours. What ice does is it constricts the blood flow and it reduces inflammation. You can use an ice pack if you have one, or you can put ice cubes in a plastic bag and then wrap a towel around it and apply that onto your back. Another option is using an ice towel by getting a towel, damping it, and putting it in the freezer for 15 minutes, then taking it out. Heat, on the other hand, should not be used initially. because heat is going to increase the blood flow to the area and it's going to increase inflammation, which is something you do not want in the first 48 hours. After the initial stages, heat is beneficial because it increases blood flow to the area and increases oxygen and nutrients to help the healing process. It also helps loosen up tight muscles as well as joint stiffness. The easiest way to use heat is to get a heating pad. If you have any impaired sensation, for example, if you have diabetic neuropathy, then please be very, very careful with ice and heat because we do not want you to get a burn from it. Another way to reduce inflammation is with anti-inflammatories like ibuprofen or Aleve. You can buy these over the counter at any drugstore and you don't need a prescription for it. I recommend taking it with food because it can irritate your stomach. If you have any kidney issues, heart issues, or you're on blood thinners, then you want to avoid NSAIDs because they can worsen your kidney damage and also increase the risk of bleeding. So please talk to your doctor if you have any of those conditions. Alternatively, you can consider something like Tylenol if you don't have any liver issues. Now, Tylenol is not an anti-inflammatory, but it's used to control pain. Other prescription medications that you might be given if you do see a healthcare provider might include a muscle relaxer, which is good for those painful muscle spasms, but all of them cause some degree of sleepiness. Sometimes they might give you a steroid pack that's good for reducing inflammation very quickly. Usually it's more for sciatica, or they might even give you an intramuscular injection like Toradol, which is also an anti-inflammatory like ibuprofen. Now, when you're in this back pain, it's going to be really hard to get into a comfortable position. The goal is to get those muscles in a relaxed position. So you can lay on your back and put a pillow or a bolster underneath your knees, and that will relax the muscles. If you're a side sleeper, you can put a pillow in between your legs. The pillow helps align the back, pelvis, and hips to take the pressure off the spine. Avoid laying on your stomach initially because that's going to put more extension onto your spine. But if you have to, you can put a pillow underneath your hips to make it more comfortable. If it's really painful, you can also try laying on your back, putting a pillow underneath your back to support the spine. After the initial inflammation calms down, which can take a few days, then you're going to want to start doing some gentle stretching and exercises to get you back to where you were. Now, these gentle stretches should be just that, gentle. Do not push past the point of pain. For each of the stretches, try to hold it up to 30 seconds or however long you're able to, and repeat it 3 times. Again, if it's too painful, just do what your body can tolerate. Now, first is the piriformis stretch. Get down onto a floor or firm surface, and you're gonna just lay down, cross your legs in a figure 4, use your hand to push your knee down, and you should feel a stretch in your butt. Hold that for 30 seconds or as long as you're able to tolerate it. And then repeat it on the other side. The piriformis muscle is a muscle that's in your butt. It's usually tight in most people, but it's even tighter if you're injured. Use your hands to pull your leg towards your chest. And you should feel a stretch in your opposite butt. Next is the hamstring stretch. So you're going to bend your knees, lift one leg up and straighten the leg, and pull the leg towards your chest. And you should feel your hamstring stretch, which is right here. Make sure your back is touching the floor. And then repeat it on the other side. This stretch is really helpful because most people have tight hamstrings because we sit a lot. Tight hamstrings cause the pelvis to tilt posteriorly, which flattens out your back and puts more pressure onto the back. Then we're gonna do knees to chest. First, we're gonna start with single knee to chest and just bring your knee towards your chest gently. And then if you can tolerate, you can progress to double knees to chest. Then we're gonna do knee to opposite shoulder, which you're just gonna bring your knee and bring it towards your opposite shoulder. This helps stretch out your piriformis muscles, your hamstrings, and your lumbar paraspinals. And then repeat it on the other side. Now, anterior and posterior pelvic tilts. Put your hands on your hips so you can feel your stomach muscles. Arch your back towards the ceiling to get some range of motion in your spine. And then push your belly button down towards the floor like you're squishing a bug. And feel those tummy muscles contract. And hold that for 3 to 5 seconds. and then just repeat it. Bring your belly button up towards the sky and then bring it down. So those are the very basic stretches for when you have acute back pain. Now let's go over some optional stretches if you can tolerate it. So for bridges, we're gonna lay on the floor, have your knees at 90 degrees, and with your heels, push your pelvis up, and you should feel your butt muscles squeeze. Cat-cow, get on all fours. Get your hands over your shoulders and your pelvis over your knees. Exhale and round your back up towards the sky. Inhale and extend your spine from your tailbone, lifting the crown of the head last. Repeat this 10 times if you can. Now, if you have any wrist pain and you can't tolerate this position, you can do a fist instead and use your fist for your wrists. And if you have any knee pain, you can consider putting like a pillow or a towel underneath your knees. Child's pose from this position, I'm gonna push my hips back, and you can widen your knees if you need to, and then just reach forwards. And you can do it to each side. And then for the seated piriformis, you're just gonna bring one foot over your knee, push down with this knee, keep your back straight and bend forwards. Again, these exercises are for the very, very basic initial phases of back pain. We're not going into detail for issues like disc herniations, lumbar stenosis, arthritis, because there are different exercises for that. There are also some things you want to avoid when you are having acute back pain. Avoid strict bed rest, as we mentioned before, because that will weaken your muscles and make your pain even worse. Also, avoid using a lumbar brace or corset. You can use it initially for a short period of time for comfort, but you do not want to be using this long term because your back becomes dependent on it and your muscles weaken, which then again worsens your back pain. Also, stop lifting heavy things. If you do need to pick up something from the ground, make sure you're keeping your back straight and you're bending at your knees and not at your back. And stop slouching because that's gonna put more pressure onto your disc and your joints. So sit up properly with good posture. There are a lot of causes for back pain and there are a lot of treatments for back pain. But in acute back pain, the goal is to reduce inflammation, control the pain, and get you back to doing your normal activities and prevent it from happening again. I hope that video helped you guys and your back. Let me know in the comments below if you want to see more videos like this. Don't forget to like and subscribe, and I'll see you guys next time. Bye for now.